I'm Dr. Chris Beyrer. I'm an epidemiologist at the Johns Hopkins Bloomberg School of Public Health.
And what's your focus in your work?
I have worked mostly in HIV prevention, epidemiology, now increasingly on the interface of HIV and human rights.
Here at the International AIDS Conference in Washington, there is a lot of talk about ending AIDS. What do you think about this discussion?
I think when we talk about this extraordinary moment of optimism, what we're talking about is what we hope is something like a turning point in the epidemic, where the high rates of new infections really continue to decline and we start to really achieve control of HIV spread at population levels. I don't know that we are going to be able to achieve this, but I think that it's an important goal. And that is, to me, what the goal is about. Now, of course, as we provide treatment to more and more people, they are going to live longer and longer. So the actual number of people living with HIV in the world is going to continue to increase. And it should, because people are going to survive. But what we hope to see the beginning of the end of is epidemic transmission of HIV. That, I think, is a goal that we have the potential to achieve, but there are some big unresolved issues.
The conference has a slogan, "Turning the Tide Together." What do you think about that? What does it mean to you?
The tide is, of course, the tide of the ever-expanding AIDS pandemic. What we want to see is that turning is declines in new infections. I think a very realistic goal is dramatic reductions close to eradication of pediatric HIV infections. Many people believe that that's probably the most achievable of these goals. To me, as an epidemiologist who's worked in many different countries, but with some spending quite a bit of time in Russia and Central Asia, I have to say that that component of the global epidemic is expanding, is not going in the direction of turning the tide. And I think the reasons for that are mostly because of the challenges with Russia and with most of the states of the former Soviet Union to adopt evidence-based programs and policies for people who inject drugs and for people who are at sexual risk. And I don't see any evidence that we're beginning to turn that tide. So I would say when we think about turning the tide together, the together to me means really the whole world is going to have to do this. We have a similar problem with the epidemic among gay and bisexual men, or men who have sex with men. The rates are rising in many countries, including in developed countries with good health systems and good access to health care. So that's another component of the epidemic that is expanding in 2012 and that we really now have to address.
What is your message at this conference?
I think that we really can begin to use this extraordinary moment of optimism. We now have to work together as a global community, researchers, policymakers, the community of people affected, to start to really make the gains, these recent scientific gains, real for people on the ground. This conference is going to be about how we implement the exciting new science and really put it to use. And the very critical question, will we do that? Do we still have the political will to do this? Are we going to be able to fight the donor fatigue? Are we going to be able to do this in the context of very tough times for donor countries, particularly Western Europe? I hope the answer to all those questions is yes, but I think a big part of what this conference is about is asking those questions.
What, according to you, what is the biggest obstacle to turn the tide right now?
I think the single biggest obstacle really is going to be the challenges of providing necessary evidence-based services and human rights services for people who in so many societies remain excluded. These are what are sometimes called the most at-risk populations, sometimes called the key populations, but what we're talking about is sexual minorities, men who have sex with men, sex workers, people who use drugs, and particularly people who inject drugs. Those populations continue to be underserved, under-resourced, to lack access to care, and we are not going to turn the tide on HIV unless they are truly included. And that is going to be an enormous challenge. It has been since the beginning of AIDS, and it still is.
There is something called the DC Declaration.
Yes.
Why should people sign it?
The DC Declaration is an attempt to pull this moment of optimism together and encourage everybody who's concerned about AIDS to join in this commitment to try and begin the beginning of the end of the pandemic. We think that it's very important for people to have ownership, to have a sense that they're a part of this effort, and that we can begin to build a wider global consensus around this as a goal. I think we've seen in the past, a good example is making AIDS treatments, antiviral therapy available in developing countries, that really setting optimistic, big picture goals has been helpful to mobilize. And so this declaration is really about mobilizing the community, mobilizing the political will, social will toward this critical goal.
The final question, how important is it to connect the fight against HIV and AIDS to the promotion of human rights?
I think it's critical. I think the reality is that the denial of full human rights to subsets of populations aids and abets the spread of HIV, will create in some ways populations who continue to be at very high risk, whatever else we achieve. And it is only by protecting the rights and providing some access to care in safe places that preserve dignity for people that we will really be able to turn the tide.